Hello everyone. Today topic is healthcare delivery system. So what is that? It is a mechanism for providing the health services that meet the health related need of the individual. So health is the fundamental right of the individual. So our main aim is to provide the equitable distribution of the health. So the health in the healthcare delivery system, our main aim is to provide health services in a lower cost to the higher group of people, so that these services will be available or rendered to the all large number of people in the country. So there is in health in India, there is about the India there is 28 states are there and 8 union territories are there. So every health problem or the health issue, that is the responsibility of their state. So the states are largely working in the health matter independently in this health delivery system of their states. So the center function is that only to policy making, planning, guiding, assisting and evaluating and coordinating the health services of the states. So there is from this it's come to know that in our health in India there is a linkage between the central level, state level and the local periphery. So there is a three link in our delivery systems. So first one is the central level, and the second one where the policy is making and the planning, guiding, assisting works are there. Then second one, the state level, where these policies are implemented, that's the state level, and the local level or the periphery level. So first today we will discuss about the central level. So in central level there are three official organs are there. One is Union Ministry of Health and Family Welfare, second organ is Director General of Health Services, and third one is the Central Council of the Health. So first we discuss about the Union Ministry of Health and Family Welfare. So Union Ministry of Health and Family Welfare is headed by the Cabinet Ministry, a Ministry of the State and a Deputy Health Minister. So these official organs, this officials committee, they work in three wings. Again, Ministry of Health and Family Welfare divided into three wings. The first one is the Department of Health, second is the Department of Family Welfare, and third one is the Department of Indian Systems of Medicine and Homeopathy. In earlier, the Department of Health and Public Health, and there is only two wings are there: Department of Health and Family Welfare, and the Department of Indian System of Medicine and Homeopathy. But in the year of 1966, there is a separate wings was established, that is called the Department of the Family Welfare. So in Department of Health, the director or the head is the Secretary of the Government of India. So he is the head of this department, and he was assisted by the Joint Secretary, Deputy Secretary, and the additional staffs. So they all worked as a team for the Department of the Health. Similarly, in Department of the Family Welfare, the head is the Secretary of the Government of India, and he was also assisted by the Additional Secretary, Commissioner, Joint Secretary, and the administrative staff. They all teamwork. They worked all as a team for the Department of Family Welfare. Similarly, in the Department of Indian Systems of Medicine and Homeopathy, there is the Secretary, who is the head of the department, and his assistant secretary and two joint secretaries are there, and the administrative staffs are large number of administrative staffs are there to organize this Department of Indian Medicines and Homeopathy. This is the flow diagram through which we see what are the body that is present in the Union Ministry of Health and Family Welfare. Let's see the function of the Union Ministry of Health and Family Welfare. The functions of the Union Ministry of Health and Family Welfare is divided into two lists. One is the Union list, and second one is the concurrent list. So these functions are under the schedule of the Constitution of India. So whatever see in the Union list. So in Union list, the functions is international health and the post quarantine. Second, administration of the central institutes in AIIMS in Delhi and the Central Institute that is in the Kolkata. So their administrative functions, that functions is carried by the Ministry of Health and Family Welfare. And the promotion of research through the research center. So the research center that is established in India, their functions, also their research is promoted by this Union Ministry of the Health. Similarly, regulation and development of the medical, pharmaceutical, dental and nursing profession for the quality or the quality care, we need active health professional. So for the health professional, so need some regulations and the development of the development, so that we can get a good health professional who will work in the field. So that is the function of the Union Ministry of Health. Similarly, establishment and maintenance of the drug standards. So where the drugs is manufactured, that should be well established, and also the maintenance of the drugs that is manufactured, that will be reached to the center, the need person, and that establishment, that also be carried by this Ministry of Health. The census collection, so the data will get that also be function of the Union Ministry. And the immigration and the emigrations, so those who are the citizen of Indian and those who are abroad, who are the Indian who are living in the abroad, they are also satisfactory data that will be maintained by this Union Ministry of the Health. And the last one, the regulation of the labor in the workplaces. So those who are working in the work industry or the labor field as a worker, so their rights and their safety, that is also the function of the Union Ministry of the Health. The second one is the concurrent list. So it is the function of, it's a cooperation between the central level and the state level. What are the functions that come under the concurrent list? Prevention and the extension of the communicable disease. So the communicable disease, their prevention and their further spread, that also be controlled by the Union Ministry of Health. The prevention of food adulteration. So nowadays the food adulteration is a very much big problem. So their quality and the kind of checkup or the prevention of the food adulteration, that should be that is the function of the Union Ministry of Health. The control of drugs and the poison. So what are the drugs that is invented by the chemist or the druggist center? So that will be equally, that will be correctly maintained, and that is the functions of the Union Ministry of the Health. And the last one, vital statistics and the population counters and the family planning. So the population is expulsion is a big matter nowadays. So the family planning, how to provide the family planning services to the people. So that is also the functions of Union Ministry that is come under concurrent list. Let's discuss the second official organ, that is the Director General of Health Services or DGHS. It is an attached office, and it is a linkage, it's a link or the input that provide the technical knowledge to the Union Ministry of Health. So here also the Director General, he is the head. He was also assisted by the Additional Director General of Health, and the Additional Director General, sir, he was assisted by a team of 3 deputies. So the deputy in the field of medical care in a hospital, second deputy that is in the public health matters, and the general administration. So in this 3 fields, so he get the technical knowledge, and this technical knowledge he will send to the coordinate to the Ministry of Health. So it is a repository organ. Repository means it's collect the data or get the data and render and send to the Union Ministry of Health for the further development of the program. So this is the Director General of Health Services. It has 2 functions. One is general and the specific functions. The third organ, that is the Central Council of Health. So Central Council of Health is established under the Article 263 of the Constitution of India. It is set up by the President General in the year 1952 on the 9th August. So here its function is the Central Council of the Health. Its functions, it gives support to the Department of Health, because it's coordinate. It also make a linkage between the state and the center, state level and the center level, and it also implement the health programs that are filaria control program, tuberculosis. So whatever the health programs that are in India, that will be implemented by this Central Council of Health. So this is all about the healthcare delivery system. Only we discuss only the central level. Next class we will discuss about the healthcare delivery systems of the state level. Hope you understand from this video about the healthcare systems. Thank you for watching. Please subscribe my channel.